Hello all. For my final project, I put together a PowerPoint presentation for my DBH 9902 course. This presentation is called A Sweet Life, A Wellness Journey for Diabetes and Obesity. So let's review the agenda for this PowerPoint presentation. I will discuss an introduction. I will also talk about why diabetes and obesity demand integrated behavioral solutions, key statistics, which really indicates the urgency to address adults with diabetes and obesity. Also, why this population need more than just medical care, the burden that it also puts on primary care. Also, introducing a Sweet Life, which is a wellness program for individuals struggling with diabetes and obesity. And also, talking a little bit about how a sweet life reaches its goal. And also, talk a little bit about the benefits to the patients, as well as benefits to providers and integrated care practices. Also, the value of behavioral health, primarily the role of the DBH individual on the medical team. And then I will also capture a summary, the call to action, and um, and also make time available for any questions that you may have. So, why does diabetes and obesity matters? So every day in primary care, we meet adults who are doing their best to manage their diabetes or A1C, as well as sustaining an ideal weight. Yet, some of these individuals feel overwhelmed, discouraged, or stuck. They're not failing, but the system is failing them. Diabetes and obesity are not just medical conditions, they are emotional, behavioral, and environmental challenges that requires more than just a standard 15-minute visit with a primary care provider. So the whole idea that I had proposed was this 6-week wellness program called A Sweet Life. The wellness group was created really to fill that gap by bridging medical care, behavioral health, and practical skills together in one place. I will show you why this population needs focused support and how this program strengthens both patient outcomes and as well as primary care workflows. So let's talk about why diabetes and obesity demands integrated behavioral solutions. If you look to the far right of the PowerPoint slide, you'll see that there is in fact a high prevalence of this chronic condition. There's also been high healthcare utilization as well as high emotional burden. And if you look at the bullet points, there definitely is the urgent need for behavioral and psychosocial interventions in adults with diabetes and obesity. You heard me discuss earlier the need for a wellness group, this one called A Sweet Life, which is a 6-week integrated care program that it hopes to bring a multidisciplinary approach to managing diabetes and obesity. The goal here is to really demonstrate how this program improves clinical outcomes, also patient well-being and provider efficiency. Additionally, the value of the DBH in chronic disease management adds unique measurable value by acting as a bridge between medical treatment, patient behavior, and population health outcomes. This is exactly what we've been discussing in class around triple aim demand. So I wanted to bring in some key statistics to outline the urgency to address adults with diabetes and obesity. Diabetes and obesity are likely to remain two of the most common and costly disease in the US. If you look at these statistics, 38.7 million US adults have diabetes. 42% of adults have obesity. Nearly 1 in 5 have severe obesity. In South Carolina, where I currently reside, 12.6% have diabetes, which is higher than the national average. These conditions frequently co-occur, creating a high risk and high cost population. This population will need more than medical care to help manage their diabetes and obesity. Here are some key factors as to why other alternatives need to be explored in managing their diabetes and obesity. And that's emotional eating, stress eating, trauma history, depression, and anxiety. all which has significant impact on someone's hemoglobin A1C. There's also diabetes distress, low self-efficacy and shame, food insecurity, medical transportation barriers. There's also concerns around the lack of medication adherence, and as well as limited access to integrated care. So I also want to talk about the burden on primary care. These conditions place a heavy burden on primary care providers. For example, there's frequent ER visits, preventable hospitalizations, there's high rates of complications such as coronary artery disease, stroke, chronic kidney disease, neuropathy, and then there is also the high healthcare costs associated with these visits and hospitalization. So providers do face burnout managing complex psychosocial needs. So I had proposed a 6-week integrated care wellness group called A Sweet Life. The target population is individuals struggling with diabetes and obesity. The goal is to improve emotional well-being, weight management, and glycemic outcomes through behavioral skills, psychosocial support, and coordinated medical care. So how will this group work? It will meet weekly for 60 minutes. We are looking for 6 to 10 participants. It will be co-led by a primary care provider, a DBH, a rotating specialists such as registered dietitian, physical therapist, or pharmacist. We will also utilize outcome measure screening tools such as PHQ-9, a GAD-7, and then the DDS-17 for screening and progress tracking. Also important to note that these are built on Biodyne group principles. So how will this group be structured? So here's our outline of the 6 weeks. So week one, we're doing a general topic on understanding diabetes and also doing some baseline assessment. Week two, we're talking about nutrition and emotional eating. Week three, physical activity and overcoming barriers. Week four, we talk about diabetes distress and cognitive behavioral therapy reframing. Week five, we talk about medication adherence, also shame reduction. And then week six, we're talking about integration and relapse prevention. So, what are the benefits to patients? We want to reduce diabetes distress. We want to make sure that patients are feeling confident in being able to take full control of managing their diabetes and obesity. We want better glycemic control and weight outcomes. We want peer support among group members. We want to reduce isolation and shame. We also want practical skills such as meal planning, stress management, and activity planning, but and also more importantly is medication adherence. What are the benefits to providers in integrated care practices, right? So the benefits are that we want to reduce repeated visits for uncontrolled diabetes, improve quality metrics, A1Cs, blood pressure, um, the BMI as well as their LDL, which is part of the cholesterol profile, enhance care coordination, reduce provider burnout, support value based care and population health goals, as well as create efficient workflows for high need patients. So, what is the value of having a DBH on the medical team? That entails expertise in behavioral change, psychosocial assessment and intervention, skills in cognitive behavioral therapy, motivational interviewing, and group facilitation, the ability to address emotional setting, avoidance, and distress, and taking on a leadership capacity within an integrated care model, as well as improve communication across a multidisciplinary team. In summary, diabetes and obesity are high risk, high cost, and emotionally complex condition. Behavioral and psychosocial factors drive outcome. The idea of a sweet life provides a structured, integrated solution. This benefits patient, provider, and the healthcare system. A DBH is essential for addressing some of these concerns. They are the behavioral drivers of chronic disease. So, what are the next steps? We're looking at launching a sweet life. So, what we need is time. We need to look at space. We need to look at money for printing materials, staff time, basic supply, look at the professionals who will be involved, as well as looking at administrative support for scheduling, referral, and tracking outcomes. Thank you. Any questions?